Hello, and thank you for joining us today. My name is Carla Legria, the project manager with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar is from our core curriculum on creating accessible, culturally responsive, and trauma-informed services, a capacity building training for domestic violence and sexual assault programs. This will be an overview of Module 6, Supporting Survivors Experiencing Mental Health Challenges, Emotional Distress, and Crisis, and presented by Cathy Cave. Before we get started, I would like to go over some of the tech details of the WebEx software that we'll be using for today's webinar. Please be aware that your screen might look a little different depending on whether you're using a Mac or PC. On the right hand of the screen, there are a few boxes. Towards the bottom is the chat feature. You may have to click on the chat icon at the bottom of your screen to open your chat. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the presenter if you have questions regarding the training content. You may contact me if you have any questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you would like to contact. You'll see a lot of options, but for this session, you'll want to select everyone if you would like to respond to a question from the presenter or to contact center staff at any time during this session. So let's test this chat feature. Will everyone please go to the chat box, click on everyone, type in where you're calling from, and then press enter. Excellent, excellent, excellent. Thank you all very much. While you can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. If this is true for you, feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a multimedia viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word Multimedia Viewer, the same way you might if you want to hide the chat box. Time permitting, we'll moderate the Q&A towards the end via the chat box, and at the very end of the webinar, you'll be taken to a brief survey. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call back if that is a problem for you. If you're experiencing technical difficulties and are unable to contact me, please reach out to the WebEx tech support to resolve any issues. That phone number, which I'll post in the chat box, is 1-866-229-3239. Again, thank you all for joining us today, and I'll now turn it over to Cathy. It seems that we've lost Cathy's audio, so if we could just have 2 minutes to see if I can resolve this issue. Thank you all for your patience.
Hi everyone, Carla, I'm back. Can anyone hear me?
Yes, Cathy, we can hear you. Thank you.
Excellent, thank you. Sorry, yes, I just all of a sudden was kicked out of audio. So welcome everyone. Carla, is it okay for me to just go ahead?
Yes, thank you, Cathy.
Okay, cool, thanks. I wasn't sure what happened when I was not here. So welcome everyone. So this is a taste of the core curriculum. The curriculum has 7 modules, And we talk about everything from kind of the basics of what it means to be trauma-informed in our work, and then we have specialty modules where we hone in on Module 5, which we talked about last time, supporting parenting and supporting children within our services in ways that are culturally responsive, ways that are where we're offering accessibility, ways that we're really thinking about how do we center the experiences of survivors and their children and support them in ways that make sense. This module, Module 6, is really about having a deeper look, a deeper conversation around how do we support folks experiencing mental health challenges, emotional distress, and crisis, also recognizing that as we're doing this work, we too could be experiencing mental health challenges, emotional distress, or crisis. And so it's important for us to think about, how do we hold all the pieces of our framework, which include everything we know about our advocacy in terms of being here for survivors of domestic violence and sexual assault, really holding that we need to have a trauma-informed approach to that work, but that trauma isn't everything. And then to make sure, or isn't the only thing, so it needs to be part of every conversation we're having, needs to be part of the work we're doing, looking at our environments, thinking about what kinds of strategies work best for connection and supporting resilience. But we also know that we need a human rights and social justice context in the work that we do, that we need a deep understanding of survivors' experiences and staff's experiences in terms of their own cultural, historical, and community context. So we're not far from those influences, and the things that we experience can either foster connection or can signal distrust and an inability to be connected and feel connected to others. And so trauma is very much a part of that history, also a part of individual experience, also a part of collective experience of whole groups of people. And then for us also to be thinking about that while we're holding on to each and every one of those principles, everything we need to do with survivors, in partnership with survivors, needs to feel collaborative. So really having a survivor-driven approach where survivors are telling us to make sure that we hear them, that we're listening to what they're saying, that we're having conversations about what helps and what's not helpful, and then we act in line with their preferences. And so that means really elevating that sense of both physical and emotional safety, honoring all of the pieces that bring someone hope and resilience, and that everything about our relationships fosters that connection. So in this way, what we're hoping to do in this module is to make sure that we make those connections between domestic and sexual violence, trauma, and the many, many ways that emotional distress is experienced, but also the different ways that we express it. So we don't all express our pain in the same way. We don't all have relationships where we feel like we can just, talk to the next person just because they're trying to be helpful and assuming that they really intend to be helpful. So trauma distorts our sense of who's helpful, what's helpful, and how do we get our needs met. And so we need to always have that in mind. And one of the things that tends to happen when survivors are experiencing emotional distress and crisis, the way that we respond within our services and within our programs can be more disruptive to someone's healing rather than supportive of it. So it's making sure that in part of this conversation, what we're really understanding and holding and honoring is that we need to respond to survivors' distress in ways that is supportive of what they need in the moment, in ways that are driven by what they tell us, in ways that resonate culturally, and that are trauma-informed because we understand what trauma responses are. We understand that the way we're meeting people at their greatest moments of distress, might not be the best time to judge someone in terms of, oh, how are they parenting, or, oh, can they follow the rules, and, oh, what are the laundry list of things and requirements and ways that we want people to show up in our services and to get support from us. And then we need to be able to do is say, oh, wait, that upset, yes, trauma does that. Or the ways this person is responding, trauma does that. So in this module, that's what we hope to do. And we start with an invitation from Jessa Winus. And one of the things that Jessa challenged us to do as we were having conversations about how do we bring a trauma lens that has a mental health lens where we're not letting go of our advocacy lens. Like, how do we do all of those things as we're working with survivors in our programs? And so this was from Jessa, that this training addresses the intersection of domestic and sexual violence and mental health, which can be challenging and can be uncomfortable. And while you're encouraged to take care of your needs, also consider challenging the root of your discomfort around these topics and seek ways to incorporate this information into your advocacy work. And so what all of that does is set a tone, set a foundation for us around recognizing that stigma and discrimination towards people who experience mental health challenges is really commonplace in our communities, in our country, in our states, in the work we do, in our own organizations, and that it's so pervasive, that stigma is so pervasive that looking down on the judgment of someone we think is not managing their mental health well, can exist to the point where we start making decisions for people, or we discount what people say is real for them and true and right. And so part of this module really does encourage us to look at and to consider all of the ways that we use language, the ways we label people and their behavior, the ways that we offer supports or don't offer support, or that we make judgments about how people are showing up. So all of that is in the mix. And so this module is geared towards unpacking some of those perspectives and looking at different points of view, and then also having some practical tools for moving forward with what do we actually do when someone is in distress. And so what I will also say is that this module is definitely designed to encourage our engagement in the conversation, to encourage us to be reflective, to think about what each of us might need to really challenge our views about mental health, about mental illness, about diagnosis, about the language we use to talk about those experiences, and how we offer supports. And so what we know is that there are lots of views and perspectives about mental health. I worked in the mental health system in New York State in different capacities, everything from peer support to administration of our state's mental health system. And there are as many views as there are people sometimes. And so part of what we need to think about is within your own programs, within your team that you work with every day, are you having conversations about those perspectives? And are you comfortable having conversations with survivors around their experiences and your own? So these are things that we do unpack in this module. It's meant to be just around 6 hours of training. So clearly what we're doing today is an overview, shining some light on some of the key themes in the training, and welcoming you all to take advantage of this opportunity, but also further opportunities to really think about and unpack what's our knowledge about mental health and substance use coercion, and how do we respond differently in our services. So all of this is in the mix. Also want to say briefly that peer support for survivors, among survivors, from other survivors, is natural, and it happens all the time. And so what can happen in our programs is, because as staff who are doing the work, or as advocates, as leaders, we may be uncomfortable with people talking to one another and feel like it's our job to manage those conversations. And what I will advocate for that we don't have enough time to further unpack today is that survivors have been talking amongst themselves for a really long time, and that peer-to-peer support, so it's one survivor talking to another without intervention from other folks, is natural, it happens, and it's a movement in our country in other arenas. So there's been, in mental health and in substance use, a peer support movement in place for decades. And so part of it, when we think about trauma and those impacts, is really to talk with people about what's the best way for us to be engaged as peers and sharing our experiences. And so, for example, I will often say to folks, when I'm involved in peer support, that it is helpful for me to share my experience, but it's also helpful for me to not share all of those details. So I might say, I was abused in childhood, or that this happened to me last week, but I won't put those details in the room because no one else needs to have all that detail in their head to understand my experience or to see if there was something that is in my experience that would be helpful to them. And so again, let's just talk about with peer support and the power of it, and that it's something that we can do as a practical strategy in our services to increase survivor support. When we're thinking about mental health and our advocacy in general ways, what we know is that no one benefits from stigma. No one benefits from being discriminated against. It's harmful for all of us who are survivors. So really thinking about, as folks who are listening in this moment and then in the work that you're doing, to really wonder about and check your biases. Where do your beliefs around mental health challenges, where does that come from? What does it mean for you? And what are the ways that each and every one of us needs to grow? Some people are disabled by mental health conditions, others are not. And yet, in systems, we often treat people who are experiencing a challenge. We may not understand what's happening for them, that they may see things or hear things that we don't see and hear, that we see that as reason enough that people shouldn't make their own decisions, or that people deserve the oppression that they're getting, and no one deserves that. So when we think about disability justice, it does apply to everyone. We need to think about and know about, be familiar with all of the ways that people are othered, that there are laws and protections in place that we need to know about, including the Civil Rights Act, the Americans with Disabilities Act, and the language provisions in the Civil Rights Act around language access services, all of the ways that we need to think about accessibility to make our services both welcoming in terms of attitude and here for folks, no matter how folks are showing up. And so are we doing things that express that welcoming, or are we putting up more barriers? And sometimes, unintentionally, we read people lists of rules when what they need is a place to rest their head, or a place to feel safe for the night, or a week, or a month. And so we start with, oh, wait, there's rules here, and let me tell you what they are. I think there's more space in the way that we interact with folks, and ways that we can bring a trauma lens to our screening, to our welcoming, to our service environments, to the ways that we treat people, so that folks are mostly having access to supports that are filled with dignity and respect and both physical and emotional safety. And so we have all these intentions to be culturally responsive, to honor folks, to provide safety, if we go to some basics, right? To really think about what are the ways that we understand someone's experience and how can we be helpful. So we've got all kinds of intentions around how we intend, as we're doing this work, how we intend to show up, how we intend to collaborate, how how we want to engage, how we want to think about children in the context of their families and their experiences. And if survivors are parenting, that we're offering all of those supports, that if someone is really struggling, we're here for it. So we've got all of those intentions. And then there are things that get in the way of that. And so in my brain, I like to think about them as the what ifs, right? So what if there's something we don't know? We're not sure if something will help. Something comes up that I've never experienced before. So I happen to have worked quite a bit in mental health, as I was saying earlier. So I've worked in a housing program. I ran a children's mental health program that was therapeutic foster care, but working with families, entire families, and keeping kids connected to their families with the plan and hope of kids being able to be, back home with their parents who are safe for them to be with. All of that work, and one of the consistent themes, and it still comes up in our advocacy, is that sometimes we're not afraid of what is happening, we're afraid of what might happen. And we're afraid or worried about, I'm responsible for so many things, and what if something comes up that I can't manage? So sometimes we get worried. We, in our worry, in our concern, can screen people out of services and not be welcoming. We can make folks so uncomfortable that they don't want to stay and take advantage of what we can offer. We may unintentionally or intentionally may be discriminatory against someone because it feels familiar or we had a bad experience in our past with. And so we bring those fears and feelings to what's currently happening. We often engage in labeling, and, we're so exposed now to the language of trauma, for example, that people will talk about being traumatized because their favorite things are not at the grocery store. And so the language we use can get flippant, and it can get to a place where we lose sight of that these are real challenges that people are having to navigate in their daily lives, and how can we be supportive sometimes gets lost behind what are we afraid of. And then there are times when we do need to know, what are our crisis plans? How do we call for assistance? Who do we call? When do we call? What's the process for calling? So what are the plans and what can we act on? So I would invite folks, if there's anything else that gets in the way of our intentions, to please go ahead and put some messages in the chat. And if you have questions also, put them in the chat. Anything that comes up for you. Try to keep this as interactive as we possibly can given our virtual environment. If there are any thoughts about the what ifs, what else don't we know? What might be getting in our way of acting in ways that we intend to be? So while folks are thinking about that, I will say a little bit more in terms of screening people in, not screening people out. And, sometimes it can be subtle and we don't even notice that it's happening. But we start to hear things or say things like, oh, if you have medication and you need help with that medication, we might not be able to help you with that here. I wonder if you'd be better served someplace else, right? Or we might be thinking things like, well, if you're actively drinking, then you're not a good fit for us. Maybe you would be a better fit for someone else. And so when we know and understand trauma, we know that trauma responses and the ways that people cope are really pretty common, and that it makes sense given what people have experienced. So when people are struggling with their mental health, whether that's trauma-related, whether it's a long-standing mental health challenge, I think we've learned in the pandemic that, so many more of us are either our mental health is impacted, or we're more tuned in to making sure that our mental health is not more impacted. But we notice that anyone can have a mental health challenge. It's a human condition. And so we need to get past some of the fears and judgments that we have and figure out ways of how do we support folks given their needs, given their experiences, and how we can best bring our supports to that. And so there were a couple of challenges that folks mentioned that I really appreciated being able to see. The lack of experience, not knowing what to do, not knowing available resources. Thanks for those. Really appreciate that, everybody. The what ifs are the real challenge for our hotline advocates. How do we overcome those? Sometimes it's around safety and communal living. Someone has a strong personality, and if they become, sorry, I missed this thread. Just moved faster than I could read. If someone has a strong personality or if they become violent. And so thank you for sharing all of those. And one of the things that happens in this conversation is that, yes, those are real concerns and real what-ifs. And when we act on it from a place of worry and what-if rather than who is this person and what's happening for them right now, and how do we engage and how do we talk about the resources that we have. And then someone said balancing the offer of support with people who might not have insight. And so here's the thing. We are meeting people and interacting with people sometimes at the height of their distress. So think about that. And at the height of their distress, if we're doing that that screening, right, having that conversation, the only measure is someone experiencing violence, and is that an experience that we're here to provide support? All right, so that's the bar, right? If you're having these experiences, then do we have space? And what happens is all the what-ifs get in the way of that, and we start to put in extra hurdles for survivors to jump through or to jump over. And so this training does unpack that, and we spend time thinking about and talking about the range of views to get at those fears and worries and concerns, and then some practical strategies. And then there's a response that I was just seeing. The most important thing after determining safety is to communicate that you are hearing their pain, what they are going through at the time. Even with strong personalities, we can show empathy while recognizing their strengths. Love that. So thank you, thank you, thank you. Right. So a part of the conversation in this training, and then Module 7 is our module on substance use concerns and supporting survivors. And so we talk about, in these two spaces, really thinking about coercion related to mental health and substance use. And so part of the reason for this conversation is to really make that connection to our advocacy, and why are we here in the first place? And really spending time understanding the things that people who choose to use violence against their partners for control and to maintain that control will sabotage recovery, will force survivors to do all kinds of things. And we understand in our advocacy the domestic violence piece of that, the intimate violence piece of that, and where we start to question and we wonder and we worry is when we don't understand the coercion that might be related to someone's mental health, or might be the ways that an abusive partner prevents someone from having treatment, prevents them from being able to participate in their own recovery, prevents them, manipulates them, so you don't know if what you're experiencing is a mental health challenge, or is this my abusive partner telling me that I'm crazy and that no one would believe me and that no one would support me. And so we have to be really careful in our services that we don't replicate that response in the way that we are responding to survivors. So yes, with empathy, yes, understanding distress, yes, with really understanding that there are times when abusive partners have done things to survivors that seems incredulous, but in our advocacy, we know to believe. We know that's to be true. And so it's making sure that we have our minds open to those same kinds of understandings that are related to mental health and related to substance use. And so our advocacy has to broaden, and we have to extend ourselves and extend that empathy so we understand and we're here for it. And that's what we hope to accomplish with this module. So in the pieces around understanding distress, we do in this module review trauma responses, and we've covered that in this webinar series, and we've talked about how trauma responses are automatic. They are not within someone's control in the moment, that the survival response is for flight or fight or freeze. Those are typically the responses that folks have. And it's not like I can look at my watch and say, okay, I'm going to be afraid in 5 minutes, and my response to that is going to be, I'm just going to leave, or I'm going to fight back. And that's not how trauma works. Trauma responses, we may be aware, we may be unaware, we may not even know that how we're responding or what's happening around us, because all of that thinking and planning that we often want survivors to do with us, when they're in a trauma response, it's not available. So we really need to understand that the distress that is present and in place when we meet survivors is not something of their making or within their control, and that those responses are survival responses. And so whether we respond by running away or fighting back, or let's say I'm on the phone with you and I have a really strong personality, well, that makes sense given the distress that I've experienced. So if I've experienced violence and I'm calling for support or somehow accessing services, what I need to be met with is understanding and empathy. A sense of, am I safe right now, is great. A sense of, how can we be helpful? What can we do? And to begin that process. And that's where our services begin, is right in that very first contact. And so we talk in this module about things that we can offer to folks because we do understand that distress. And I'll come back to that in a bit. Sometimes with mental health challenges, the things that we don't know are the things that we're afraid of. And so I've had experiences of my own, experiences with family members, where I'm fairly comfortable talking with someone who hears voices. I'm fairly comfortable talking with someone who sees things that I don't see. And so that's been helpful to me in this work, in this advocacy, and in my peer support work with survivors, right? And so one of the things that does come up often is, we worry about, is what we're doing enough? And so one of the things that we talk about in this module is that what we're trying to understand is that psychiatric disability isn't the same for everybody. Some people are disabled by their experiences with distress and crisis and violence and mental health challenges. Others are not. Some folks are able to manage and are able to talk with you very clearly about what's happening for them and to ask for what they need. Others cannot. So we know that mental health conditions interfere with how people learn, how they communicate, how we think, whether or not we get enough sleep, and a whole host of other things. So really being mindful that, again, you're meeting someone at their greatest distress, and they may not be able to think clearly, talk clearly, communicate clearly, see you as helpful. There's all kinds of ways that trauma brings up lots of distrust. And so making sure that it's not our fear that's driving our conversations can be really helpful when we try to understand where survivors are and what they think might be helpful. And so even if someone is struggling, that struggle may come and go. It doesn't necessarily mean that it's permanent. And once we provide safety and support, people are often calmer, clearer, able to communicate more clearly about what it is they want and need. So all of those things are possible with time and patience and understanding. When someone is having a trauma response, their trauma response can show up in all kinds of different ways. So dysregulation is that disruption of our sense to kind of maintain our own balance, our own sense of safety and well-being, our own connections. So dysregulation could mean we have racing thoughts, jumbled thoughts, might not be able to communicate clearly about a thought. That's really common and makes sense given what trauma does to the human body, right? And then if we think about dysregulation can also disrupt someone's sense of feeling safe with you, feeling connected to you, being able to know where they are, where your body is, even in a room full of things, in a room full of people. Sometimes people will need to pace because they're trying to manage just staying calm and being able to listen and take in the information you're giving. So it's really being able to recognize that dysregulation is a host of feelings that may come and go. Sometimes people cry a lot and can't stop. Sometimes people are angry and they can't stop being angry. Sometimes folks, express themselves in ways that are new to us in our advocacy roles. So part of what we have to think about is that dysregulation makes absolute sense. And how it can show up is that people are scanning for danger. They're overwhelmed. They may not, some small thing might happen, and they are just not able to let it go or get beyond it, and that those small things are big. Trauma does that. And so rather than be surprised by these impacts of trauma, we need to expect these impacts of trauma. Sometimes people will be very engaged with you and having conversations and trusting you. And then the next time you meet, or even a few minutes later, they don't feel that trust and things feel very disconnected. And so people may minimize either what's happened to them or compartmentalizing, which is even when something very big is happening, we can kind of shut that off in a part of our brain and go do the next thing. So it's like, having a really bad experience before you get to work and then being able to say, I'm at work, I'm just going to put that aside for now. And you put it away, and then it comes back later. Well, sometimes what happens when we put things away is those things come back and are expressed in really unexpected ways. And so when we minimize things, when we say, oh, we're just going to get through it, we're not always doing ourselves or others a favor. And so part of the conversation is to think about how we are impacted and how we respond to distress ourselves. And that's also part of Module 3 of this training series. Sometimes people have difficulty sitting still, for example, or if they're having flashbacks. And one of the tools or resources we talk about is being able to ask survivors what they think would be helpful. And so when you're not sleeping, what else helps you sleep? If you are having a hard time making decisions, what is usually helpful? And sometimes it's just that conversation that's enough, and sometimes it takes a lot more than that. Again, it's also natural that after experiences with trauma and violence, or as a result of that, people may use substances or misuse substances. So this is all part of, and can all be part of, managing how you're navigating a trauma response and what is it that you can do about it. And so as survivors are sharing experiences with us, the module offers ways that we can actually be supportive in return. A a couple of other key themes to take away are that when we think about how are we more trauma-informed, more creating more accessibility to our services, trying to make sure that we're being culturally responsive in the work that we do, is we always want to think about that our environments matter. And just because we say to someone, you're safe here, does not mean that their alarm is turned off at all, right? And so when people don't feel emotionally safe, and we want to talk about safety planning, that there may be an absolute disconnect for that person in this moment. Because what happens when your fear response is activated, and it could be by trauma reminders, other kinds of stressors like our rules and the ways we have expectations of people. There may be some relationship stressors, either between survivors or between survivors and staff, and how are people navigating and responding to things. And so all of these pieces can make it really difficult to calm your central nervous system and engage in planning. So if I'm feeling afraid or unwelcome, unwanted, not sure if I'll be able to stay, not sure if people are trustworthy, then it's really hard to think about making plans and talking about the next pieces of my life and what am I going to do about those things. And then one last piece to think about as we move forward is really around the amount of privilege that we have in our work as people who are doing the work. So we are making decisions, hopefully with people, but we're often making decisions about people and for people that impact them. So who's included in decision making? What are the messages that we're giving to survivors, especially those who are behaving in ways where we're uncomfortable? So what are we doing with all that judgment about are people worthy of our services? Are they somehow capable or not capable of participating in what we do? Are people complicit? Do they have something to do with their own, lack of well-being? What did they do? And so we know in our advocacy that in terms of the violence, we need to hold people who are using the violence accountable for the harm they cause. We don't often recognize those same harms when a survivor has a mental health challenge, or we don't recognize that same right to autonomy, agency, and safety because someone has a mental health challenge. And so this calls on us to rethink, again, how are we having these conversations within our services? So after we lay the groundwork with some of those conversations, differences in views, looking at power and privilege, thinking about trauma responses, we then explore distress and crisis. And in the exploration of distress and crisis, we name that they are two different things, that distress is that sense that, something is happening, I've been harmed, I'm uncomfortable, I'm unsafe. And crisis is often fueled by our response to someone else's distress. And so we talk about that in this module in terms of what are the things that are happening with survivors and that we're responding to, and what does that bring up in us that we're responding that way. And so sometimes it's the way, someone reminds us of somebody else. Sometimes it's the way that survivors are coping, and their coping strategies are more distressing to us. So, for example, if someone is self-harming or uses self-injury to either harm, to cut themselves or to burn themselves or to pick their skin, or the number of ways that can show up, that we're often alarmed, and in that alarm, we can be othering. So we want to talk about the difference between distress and crisis and what crisis looks like when the support is there in our advocacy and the support is there for survivors to respond in different ways. And so we introduced several tools. The first tool is, do we have organizational policies and practices that actually support us to do the work that we do? And that was something that came up in the chat a little while ago. It's like, do our policies line up with how survivors best benefit when they're challenged right, with mental health challenges. So what is it that we say and do? What are our policies? And can we act on them? Oh, I love this. Someone put in the chat that we need to remember there's no perfect or easy survivor, right? But we can accidentally respond to an individual survivor with those labels. Yes, yes, and yes. So we need to make sure that our organizational policies don't support othering of survivors who are in need. So that means looking at what are our policies around medication, what are our policies around the ways medications get managed, what are the ways we even have conversations. If someone says they have a psychiatric diagnosis, are we able to ask questions? Are we comfortable enough to ask those questions? So really thinking about that. We talk in this module about having mind-body practices that actually address that sense of overwhelm in your mind, body, and spirit. So having things that we can do, practices that we offer throughout the entire training so that we all can have practice in some breathing techniques, some coping strategies that may help someone who's feeling othered and disconnected feel more grounded and present. And so those are all things that we can do in terms of supporting survivors and their needs. We have some strategies for paying attention to the physical and sensory environments in our services. We have strategies for asking about what helps. And so those are direct conversations with each and every survivor. And we talk about having ideas for when someone can't tell us what they need. So in taking a quick look at organizational policies and practices, here's an example from DASH that we had permission to share when this module was being created, making sure we have alignment in our values and our policies. So having the freedom and responsibility to determine what is right for you and to be self-governing. And so that's an example of a policy that supports survivor agency, that supports survivors to make their own decisions about what is best for them. And often our discomfort in our work roles is that what we're saying is really acknowledging that we are not in control. Survivors are in control to be self-governing. And so when people have mental health challenges, they can choose their own actions and their own treatment without having been forced by the program. And so again, another way for us to think about, is there something we can do differently? And then I wanted to share a resource that we talk more about in the training around responding to the impacts of organizational trauma and affirming in the supportive ways. Right? So we have a tool to support implementation of accessible, culturally responsive, and trauma-informed services and supports, talking about the organizational climate and organizational trauma. So as mentioned, we have tools for mind-body resources that we talk about in this module. And again, these are practice, but we also ask training participants to share practices that work for you. So what works for you, what is helpful, what is supportive. We talk about ways that, and then not just talking about ways for being clear about what we could do, but we're demonstrating those during the training, but also asking advocates to think about in your work, what are you comfortable to try, and what is it that you're not comfortable to try? And then to stretch. So comment in the chat, at some level, the victims need information that we can provide so they can make decisions for themselves. Love that. And so absolutely yes. So one of the challenges, and when we think about our discomfort around mental health challenges, is that we often get into this place of either or. Either the survivors are leading or we're leading. Either survivors have expertise or we do. So here's the thing. Survivors are the experts on their own experiences. We have tools and resources where we can support survivors by sharing those resources. by sharing the possibilities, by sharing what's coming up, by sharing ways of interacting, by sharing legal tools and resources. So we have advocacy tools and resources, and we can use them. The challenge is when we get into that either-or space, we stop being creative, we lose touch with our empathy, and we can get caught up in this, either you're going to do it my way or you have to go. And those are the things we have to avoid in our work together, right? One of the sets of tools that we talk about, changing our environments, we look at services. We have an organizational reflection toolkit that helps us sort that out, and we bring attention to that to make sure that we're looking and considering all of these ways where we could make our services and our processes more flexible so that we can accommodate a wide range of needs and experiences. And so when we want to know what will be helpful, when we want to know, the best thing we can do is to actually ask survivors. So to make it a part of your process, so that's not thinking about when everybody is in crisis, they're still feeling their pain, they're trying to figure out, are they safe in this moment? That's not the time to absolutely say, oh, let me ask you 400 questions about what would be helpful to you. What we can do when we're first meeting people is giving people information about trauma, or as a friend of mine likes to say, a universal informing. So we can talk with folks about what they're experiencing. We can actually let them know that it makes a lot of sense if you can't sleep, or if you can't stop crying, or if you can't stop yelling. So our natural response is, if someone is yelling, is we say, stop yelling, you can't talk to me like that. And an alternative might be, given what you've experienced, it makes sense that you're yelling. Would something help settle you? Is there anything we can do together so that you could feel more comfortable right now? Because trauma does that. So letting people know that trauma does this. What are those messages? How can we show up for folks differently? How can we support people differently? How are we here and in alignment with people in ways that make sense? Telling there's a name for what you experience. Oh, it makes sense that you are feeling like your emotions are all over the place. Like being able to validate what folks are experiencing can be incredibly helpful, can help people feel more safe emotionally and more comfortable, and then when they're ready, able to do some work together with you, where you get to bring all your advocacy skills. And so rather than bumping up against people's emotions and their fears and their ways that they're struggling, right, we want to make sure that we're responsive to that, right? And so that's important, that we're creating that space for folks to be able to be who they are, respond how they are, because we need to settle and calm first, and then we can do the work that we're here to do together. And that there may just be moments where people feel accessible, right? And it may be that they're accessible in this moment, not the next. I want to go back here for just a moment. Again, just to say that different people may need different messages at any given time. So someone may feel calm and centered and connected to you today, and then later on not. So later they might need the message of, that makes sense. It's okay. I'm still going to be here. Let's take a minute. Let's go for a walk. Let's stretch. Can I get you a cup of tea, a drink of water? Is there something you need to do first so that we can then work together a little bit later? And make that feel possible and make that feel okay for people to be in that space, because that's what trauma does. In this training, we offer a resource called a Guide for Emotional Support. And it actually is a guide for having conversations with survivors to ask them when you're overwhelmed or distressed, What does that look like? What does it feel like? What do you think is helpful? And so if somebody tells you that, you then want to offer them what would be helpful. We also ask, is there anything we should never do when you're in distress? And make sure that whatever survivors tell us not to do, that we don't do it. And so always asking about, is there anything we can do together before we get started to support you to feel more safe and more comfortable? And then go ahead and create that. So there are all kinds of ways that we can respond differently. And then when people can't tell us what they need, we have some strategies for that. And in general, again, this is not meant to be an everything you wanted to know about crisis intervention. These are some steps towards connection when people are in that environment where there's so much distress and they are in distress, things that might be helpful, that one person leads, and make the connection. You remind folks of how you know each other, that following these steps and staying clear and focused and calm, if others are around, asking them to leave, not rushing, taking your time, being concise with your language. Don't fuel people's beliefs, but also don't challenge them. You're not in this moment trying to find a cure for someone's distress. So if someone is hearing voices, it's not your job to stop them from hearing voices. If someone is seeing things that aren't there, if someone is self-harming, it's not your job to make someone stop. It is our job to make the connection, to check in about physical safety. Is there anything that needs to be taken care of? Do you have a cut? Do you have a scratch? Do we need Band-Aids? Practical strategies, practical approaches that really let people know that we're here and we're connected. And if you do need to call outside support, to be absolutely in agreement in your program about what are the partnerships, who do you trust to call? If there's been an overdose or withdrawal, it's calling emergency medical attention and doing that right away. But do people know what the policies are, and can people act on them? And if the police are being called, why are they being called, and who's making the call? So making sure that all of that is revisited in your policies and the ways that you think about it and look at it. And then getting feedback from survivors. Have we actually been helpful? And so really simple way is, was this helpful? We had a conversation today, we made some decisions today, or we decided to meet again, tomorrow, whatever that is. Even if it's the smallest clear decision, acknowledging whatever happened, whatever that decision was, and appreciating that the person shared, and then asking, what we did today, was that helpful? Not assuming that because we were here, we were helpful. Getting that feedback matters. And a word from a survivor. When I'm in crisis, I need people who can be with me when I am in distress, be present with me when I'm in pain, who acknowledge my pain without trying to fix it. This takes someone who knows their pain and is not afraid of it or yours. So as we have just a couple of minutes left, I wanted to just make sure folks have contact information. There are a few comments in the chat. It can be helpful to talk with survivors about different ways other people cope with stress and fear. Absolutely. I love that as a strategy, especially if we're naming that it is common that. It's common that folks might feel this way. Sometimes what helps is this. Absolutely. And I think, sometimes when we ask people questions, we want them to have the answer in the moment. And sometimes, as someone is pointing out in the chat, folks might not have an answer. They might not know. And so, again, trying things together, being thoughtful about what we offer. I love the physical activity, art, meditation, going outside, all of those things. Those are things that we can offer, and sometimes we don't offer them because we worry that we're not doing enough or that that's not part of our job. And part of this module is to increase our comfort with exactly that, with offering those kinds of things. So I want to thank you all for your time and attention, and I'll turn it over to Carla to wrap us up.
Thank you, Cathy. Thank you so much for today's webinar. And thank you to everyone who joined us today. Once the webinar session is closed, you'll be redirected to participate in a survey. Please let us know what worked and how we did today. Within the next week or so, we will send you a follow-up email with a link to the recording of today's webinar, in addition to the slides and any handouts that were mentioned, all which will be available on our website. You will also receive a certificate of attendance for your time today and a link to the evaluation for the webinar. Thanks again, and we hope you have a wonderful afternoon.